And welcome back to the Osteo and Physio YouTube channel. As requested, today we are going to be doing a video on anterior cruciate ligament injuries of the knee. Your anterior cruciate ligament is a dense connective tissue attaching between your femur to your tibia. It is absolutely vital in resisting anterior shift and excessive rotational movements. It's very common among sporting activities, that is where it's normally injured, and it can either be through a collision, through a contact sport, or your body falling into an awkward position, typically where it's coming inwards and at a rotational point, which can cause injury to the ligament. Also really common with ACL injuries to have the involvement of your medial meniscus and your medial collateral ligament, which is why when we screen for this injury, we also want to test for those structures as well. The clinical presentation for an ACL injury can be very, very diverse. So from a grade 1 injury with no change really in laxity or instability through the knee, just a little bit of tenderness, to a grade 3 where there has been a complete tear or rupture of the ligament, which can lead to significant bruising, instability and loss of control on knee movement. So the person feels very, very unstable. When they're coming in to see us, typically we might be diagnosing maybe a grade 1 or 2, because normally if you have a grade 3 injury with that complete rupture, most people are sent off to A&E straight away. If you're suspected to have an ACL injury, and this is diagnosed within our clinics through anterior shift tests and testing of that specific ligament, as well as the surrounding structures, the most common thing we want to know is the severity of this injury. So most people, so I'd say 95 to 99% of people that come in with a suspected ACL injury are sent off for radiographic imaging, typically an MRI. And the reason why is because there's such a diverse range of symptoms, we want to be able to rule out through imaging any other structures that may be involved, but also any damage potentially to the tibia, so the tibial plateau, or any of the other surrounding bones, depending on the onset of the injury. So it gives us a very clear vision of what's going on and what is needed to manage that specific patient. And most of the time surgery is involved if there's been a significant partial or complete tear of the ligament to help repair long term. So where do we stand as osteopaths talking about ACL injuries today? So the most common thing I see, and also where we have physios in our clinics, are patients working alongside them post-surgery. And the reason why is it's really important to regain movement, reduce swelling and soreness, as well as regaining strength and stability through the knee long term. So what we're going to be sharing with you today to give you a taste of the type of exercises that you might get for an ACL injury is some different exercises to get the knee moving, to re-improve that strengthening and balance and allow that support long term. So today we're going to be going through different exercises that would be implemented at different stages of rehab for your ACL. So the first exercise here is normally done within week 1, and it's all about taking the tightness and the pressure off around the kneecap, as it's very common, although the ACL is around the back and deep inside the knee, for lots of different structures to get very, very tight and sore. So you want to spend about 1 to 2 minutes just gently massaging around the knee. What we then want to move on to is actually moving your kneecap, and the reason why is when you've had surgery, which again is for that repair, everything becomes very, very stiff and tight, and for that optimal mechanics of the knee joint, so the hinge movement of the knee, we need your kneecap to be relaxed. So you can hold around the kneecap or the patella. You're going to gently move up and down and then gently move it side to side. So it's all about freeing it up, and this is quite a nice thing to do initially when everything's very sore, when you're recovering, and even Jam's intrigued of what's going on today, and so we want to add in that optimal movement. The next exercise looks at activating through your quadriceps muscles, so again to help regain that full extension which is normally lost. This might come in week 2, potentially, once that swelling, if there is any, and soreness has come down. And I always prop up with a towel underneath the knee because we struggle to fully hyperextend once we're recovering post ACL surgery. So you want to aim to push the kneecap very gently down towards the floor, so pushing it into the towel or the pillow underneath the knee, holding for a couple of seconds and then relaxing, and aiming to do that for about a minute. The next thing we want to do is very gently regain that full extension of the knee joint. I am purposely not going the full way. Initially you'll really struggle to go that full extension, but it's something that you want to regain quite quickly, because the more we can move the knee, the less it will feel stiff and sore. And so what we're doing here is we're gently sliding the foot down into that extension, not hyperextension, and then we're using the hand to help bring it back to that neutral point, so bringing it back up, because sometimes we struggle to fire around the back into the hamstrings post-surgery. This might be integrated in week 2 or week 3 of your rehab program to regain that movement. What we're then looking at is activation of different muscles. So again, this might be week 2, week 3, depending on how well you're recovering. And we want to activate through the calf muscle, so your gastrocnemius muscle, by lifting the foot up, holding for a couple of seconds and then relaxing. So not only is this pumping movement into the knee joint, but you're trying to get all of the surrounding muscles to fire, so it's a lot easier with that rehab to recover. This is the exact same idea when we're thinking about the hip abduction as well, because although it's the knee that needs to move and then we're going to strengthen, that hip abduction can take the pressure off the knee joint and help with that optimal movement. So you want to do this for about a minute, hold on end range for a couple of seconds and then relaxing. Again, this might be added in week 2, week 3. With all of these, if you're working with a physio, they're going to be enhancing it as quick as you can go. So if you're suddenly regaining movement very quickly, this particular exercise, and same here when we're activating through the hamstrings, so holding for a couple of seconds and then relaxing, you might be adding more resistance quite quickly if you're recovering very quickly. So these are all body weight exercises today, just to regain that movement, so very early stages. So you want to very gently bend the knee. So again, this will be a struggle, it'll feel quite stiff, quite sore. Hold on end range and then relax. And again, just remember, with proper ACL rehab, you're going to be doing it probably in a gym setting with weights and resistance to regain that full stability long term. And then finally, the last one I want to show you is gentle activation of the quadriceps. So again, this is helping regain that full extension, not hyperextension, where you're activating, holding on end range for a couple of seconds and then relaxing, aiming to do this for a minute. Because if we can regain that stability around the knee, particularly in those initial phases, and get you walking, so you want to be adding in walking as well as these exercises initially, it's so much easier to progress with your physio long term to add in more strengthening to help restabilize and strengthen around the knee.